NHS waiting lists reach unprecedented numbers. The government has been introducing Community Diagnostic Centres. They say these are one-stop shops for life-saving tests. They've just announced that 19 more centres will open this year as part of what the Health Secretary is calling a recovery plan. But will it have any impact? Let's go to the Minister for Roads and Buses, Richard Holden. I don't know what's got to do with you, Richard. I don't know what the roads and buses bit's got to do with you and the Community Diagnostic Centres. Maybe it's catching the bus to get there. But Richard, this sounds a good idea if these are properly funded and it takes pressure off existing NHS outlets, I would have thought. But the main thing is, if you have a concern, I'm reading this as this is a way to detect an illness early and accessibly.
No, you're absolutely right, Eamon. What we're trying to do is, there's obviously people who didn't get a chance to go to the GPs during the pandemic, a bit of a backlog there in terms of people waiting for those diagnostics. And what we want to do is try and get as many of those people through as quickly as possible. We've got over £1 billion of funding set aside for this broader programme around catch-up. This is a crucial part of that. And we're going to have around 160 centres in the end for this. We've got 92 already set up, another 19 coming on stream this year. But you're absolutely right. This is about trying to catch those things early for people, because actually for them sometimes it'll be the good news that actually there's nothing to worry about. Sometimes it'll be catching things earlier for people, and that also has a really beneficial in terms of reducing costs for the NHS, but also those better chances of recovery as well for people.
The one-stop shops are located in a range of convenient settings for people, like shopping centres and football stadiums. I mean, how is that going to be monitored, you know, in terms of safeguarding the public? How are they going to find out about it? Do we know?
Yeah, people will be made aware of these when they're in their areas. What we want to do is have them in the most convenient places possible for people so that they're easy to access, open more than your average GP surgery so that there's more time there, more slots can be filled, and with specialists in those different fields of diagnostics as well. So it's about making them as accessible as possible. All of the normal NHS procedures will be there to protect people and their data, etc. But it's about trying to get as many people through as possible, because we've got this. Hopefully, these centres we're thinking around 1.1 million extra people will be able to be diagnosed much sooner through this programme, which will help to try and get some of those concerns that people have dealt with much more quickly than if they were just going through the normal process.
Yeah,
so
it's about taking away
package that we're bringing forwards.
Yeah, it's about taking away not only the wait, because with the wait comes worry, and accessibility is all what it's about. Richard, as you may expect, there's a number of political stories doing the rounds today, and we're just looking for your comments on them. Labour going big time on a catalogue of waste on government credit cards. Now, we've been taking the view throughout the programme today, it's easy to judge these things when you don't exactly know why the expense was made, but there seems to be a big increase, certainly during the pandemic and beyond, on expense spending within government departments.
No, so I think there was an uptick during the pandemic with people working from home, but we're going to see this in the broader context. So it's around £150 million last year, but actually back in 2009, 2010, when Labour were last in, this was almost £1,000 million. So it's 85% lower. What we've tried to do is introduce some real transparency into this sector. So in 2012, we publish on a monthly basis now all expenditure over £500 on the government procurement cards. That's all available for your viewers on the government's website on gov.uk. So that's what we're trying to do, greater transparency. That's why we've seen that massive fall since the last time Labour were in office on this, but we've always got to keep an eye on it. There'll be some things, international conferences, which are always going to be expensive. In fact, it's probably more expensive sometimes not to stay at these conference hotels when you consider security and travel to some of these venues. I myself was up in Bury last week in Lancashire. I drove myself up and some of the staff from my team, and also stayed at the very nicely appointed Premier Inn. So I think most of the time all of this stuff can be done at relatively low cost, but there are some circumstances when that's just not possible.